Today in medicine, we'll talk about cyanotic heart disease. So we'll we've studied a little bit. It's when there's too much pressure on the left side, and so we have a hole in that middle muscle between the two ventricles, and the left side has more pressure than the right side. So the blood from the left side, which is already oxygenated, goes to the right side, which is deoxygenated. And that is not too bad, but it could be worse if it's not treated fast, because then we have more blood going into the lung, meaning more pressure into the lung. And each time the the it begins with the pulmonary artery, which is big, then goes to the pulmonary arterioles, and then to the to the alveoli. And so if each time it's smaller, that means it has more pressure, so it could damage the arterioles, and then it would be even harder and it would have more pressure. So that is bad. And we could think here, as we have a hole in a garden hose, and so we'll squirt out, and we can hear that in real life. We also can hear this with auscultating with a stethoscope. We can also see it with chest X-ray or echocardiogram, the ECG or EKG. And when there's too much pressure, the heart has to do more force, so it's like building up. It's getting more strong. It's getting stronger. And we can see that in the EKG because the QRS complex is bigger, wider, and also the rest over here is also bigger. This is the atrial part, and this is the ventricular part. And so for last, we're going to talk about Eisenmenger syndrome, which I talked about when we have too much pressure. So the right side goes to the left side, then the left side goes to the lung, and here we have a pulmonary congestion. And then it goes back, and that could build up and go the other way around. It would be kind of like a stenosis with a pulmonary congestion. And because of that, we have less oxygen, and that's called cyanosis, because we can, it's not the flesh, it's the skin gets a little blue because the blood is deoxygenated. The pulmonary pressure increases, the pressure in the right atrial, in the right heart also increases. That's the Eisenmenger syndrome. Or it could call, oh, and when the heart realizes that there is not much oxygen, it makes more red blood cells, and that leads to more congestion. And we can also see that in the hands. It's called finger tapping because it gets very swollen. And we can see here that the hand gets like blue, the cyanosis, and also gets very swollen.
Cuando es su cosa de fotónica.